hospitals, health systems, providers, and urgent care centers. Start with the claims you already gave up on. Denied claims, underpaid claims, partially paid claims, long-aging denials, claims already written off. Alexander Software as an edge service is designed to go beyond simply identifying that money was lost. Let Alexander analyze the claim and payment history, uncover what happened, identify underpayments and contract variants, help repair denied claims, strengthen coding and documentation review, generate detailed appeal letters, reconstruct corrected 837 claims for potential resubmission, and help pursue revenue you may have believed was gone. And for qualifying organizations, you can prove it first with a no-cost proof of concept. If Alexander proves its value, source code licensing starts at approximately $20,000, one time. Own the license for life. For the initial proof of concept, Alexander does not need access to your EHR, EMR, billing platform, production servers, or hospital network. The POC can run on a dedicated Windows computer isolated from your production environment. Connect briefly to securely retrieve the authorized Alexander Software as an edge service applications. Disconnect the computer, then analyze approved copies of historical claims, denials, and payment transactions locally. Your claim database does not need to be uploaded to our cloud. Your production systems do not need to be disturbed. For more complicated denials, you can optionally introduce physician notes, medical test results, or other supporting clinical evidence under your control. If our assistance is needed, an authorized Alexander collaborator session can provide controlled remote collaboration with the Alexander application environment without requiring the hospital database to be transferred to us. This is the Alexander Software as an edge service model. The software moves to the data. Authorized expertise moves to the data. The data stays under the hospital's control. Now, let Alexander prove what it can actually do. Begin with a defined population of historical claims and denials. Alexander can analyze denial causes and recurring payer patterns, reconstruct claims and payments, compare payments against contracted amounts to identify potential underpayments, examine coding and documentation, bring relevant clinical information into the analysis when needed, create detailed payer-specific appeal support, and reconstruct a repaired 837 claim for professional review and potential resubmission. This is not a rip and replace project, and you do not have to buy the source code before you know whether the technology creates value. Start with claims you already have. Start with money you already earned. Start with revenue you may have written off. Prove the value first. Recover the money first. Then decide how far you want to take Alexander Software as an edge service.